One of the stories we're watching in the UK this morning, a strike by both junior and senior doctors. Junior doctors, what we would consider in this country residents. They are striking together at the very same time. Both doctors took individual job action earlier this year, but now simultaneously striking. And there are fears this could put more pressure on a national healthcare system that is already crunched. Abby Kugathaasan outside University College London Hospital. We can see the activity behind her. Good morning, Abby. Tell us what's happening there today.
Good morning, Heather. As you mentioned, I'm outside University College London Hospital here in the center of the city. And as you say, both junior and senior doctors going on strike at the same time today. And I want to say that as cars have been passing, some people have been honking their horns, which has elicited some cheers from the doctors. Now, they are in a pay dispute with the government. The Rishi Sunak government has offered a 6% raise to most doctors and about 9% to junior doctors. But the doctors say that doesn't make up for inflation. The British Medical Association says, in fact, new doctors make less than a barista. And junior doctors, as you say, are what we would call residents in Canada. They make up about 45% of the workforce. So as you can imagine, their absence in health centers and hospitals will have an impact on patients. Hospital leaders are concerned that this will test safety limits. They're saying that some appointments and treatments have been postponed. Emergency care will continue as per usual, but staffing is at a Christmas level. And so there is some concern that an already backlogged healthcare system, given the pandemic, will face a further crunch, as you say. Now, one senior doctor explained the impact that these postponements of treatments will have. Let's have a listen.
The biggest impact is on the surgery for our cancer patients. And although this is what you would term planned elective care, clearly it's essential that these patients are able to have the surgery for their cancer within a timely fashion. Harm will be coming to patients as a consequence of the repeated cumulative industrial action that's gone on for so long.
Now, England does face a shortage of doctors. I was just speaking to two junior doctors. One of them has been working for 10 years. She said she's going to consider moving to Australia. Seriously, there's actually one of the doctors holding up a sign that he's considering coming to Canada because they say they chose this field to help people in their country, but the system doesn't allow for them to do that because they have, university bills, but they also have to pay for exams, and the hours have really stacked up and they're unable to continue working here. Again, the British Medical Association saying that some new doctors make less than someone who works at a coffee shop, Heather.
That's a pretty striking comparison, Abby. Thank you very much, and we'll be back to you for updates there as the job action continues.